Individualized funding transforms lives. It gives people complete control over how their supports are delivered. It gives people the absolute freedom to live the life that they want to live.
You get to pick your own people. You can typically pay higher wages. You can attract better people. You can pick people from your own social group. Another big advantage is the flexibility. Instead of being on a weekly use it or lose it basis, if you have less need one week, you don't lose those hours of support under individualised funding.
It's about people living the life they choose in their community, but also having the identity in their community, which is a really unique thing that we do.
The cultural thing.
And being involved.
A lot of our whaiora spend a lot of time at home, sometimes feeling disconnected from their community. And we, through our program, help encourage them to participate in their community.
Well, the whole idea is to get people out of institutions where they're in a big crowd, they all go out in a bus, sometimes they don't get out at all, it's not individualised. As soon as they go into these residential houses, they're flatmates, literally. Staff really are always checking to see that people are well and healthy by colour, by their mood. You know people, you know if they're sitting around and they don't usually sit around, that there must be something wrong.
So all three of our programs support parents and carers to understand the individual child and to nurture them well. So this is helping a lot of clinicians working in health, in early childhood, in developmental services, around how they can best intervene to improve relationships.
I think for our Life Fit program, it opens up a lot more opportunities for individuals with their health and fitness goals.
We sort of teach them the skills on how to live independently. Things like cooking, their own meal, cleaning up their house, basically taking care of themselves. They're very independent, they're very mobile. They get up in the morning, they go to work, catch the bus, and then they come home after work, they catch the bus again to get home. I'm here in the evening to make sure that they don't burn the house when they do their cooking, making sure that they make their lunch for the next day, making sure that they get home all right from work. They know how to take care of themselves. They know the protocol, the process of who to ring in case of an emergency. They know how to dial 111.
It's a really awesome thing to see when I see them from the very beginning when they first come into the service to when all the services are in place, and I talk about with the service coordinator how things are going and how they're achieving things that they really wanted to do that were important to them.
Some of our success stories for you wouldn't be a success, but for us it's that tiny little step. Like on their weekend, I took a young man who has a phobia for technology into a certain electronic store. It was this tiny little thing that no one in the world would ever think was amazing, but for us it is.
And that's a huge challenge for him to overcome.
It's a massive challenge. Yep. For him to be able to touch technology is incredible. So
it's taken 13 odd years of, no, let's do it together, we'll show you, and then you can do it. Yeah, our goal was over the years to get her as independent as we possibly could, and we've achieved that. When I think about the people that we support in Hamilton, she would be, pretty special.
It's great to be able to work with people on an individual basis, maybe a number of times if necessary, their families, larger groups, just to help them manage with whatever it is that's holding them back with their hearing or lack of hearing.
Every day is different, and it's a great feeling when you get a phone call from someone to say they're happy and can't wait to see their new worker the following week.
It's an amazing amount of trust in some ways that people put in my abilities, but also that they are given the opportunity to realise their own potential as well.
For me, it's that being invited into someone's home and you get to know the whole family, and that's where we're slightly different to other services, is that we get to be part of the family.
I'm here to look after John and David and to make sure that their cares are met, their needs,
and their goals. I love looking after them. They're a lot of fun, a lot of laughs, a lot of talks we have, and we have really good times.
You know, she likes looking after us guys. It's like having a wife happen to be married.